Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. As usual, you can also visit my playlist. In the playlist, I have provided almost all the topics in a very systematic order, so you can make use of it. And it is quite easy for the continuous study. My dear friends, as you know, we are discussing about vaccination. Two or three cases we have seen which represent different clinical scenarios that we are facing in the OPD. So today we will have one more important case, or rather a scenario. Now, this is a 10-year-old boy by name Ramesh. He came to your OPD, pediatric OPD, and he is totally unimmunized since birth. Since birth, none of the vaccines has been given to this boy, and he was brought to you with an injury. So while playing, he has got an injury. Probably he has been get stuck with an iron material. So while playing, he has got this injury. Now, as the iron material has been the cause for the injury, it may be rusted. So parents are quite worried, and they brought to you. And after examination, you found that yes, this is an injury by a iron material, maybe rusted, and this requires a TT. This requires TT. And now, what you need to do as a child is not taken any DPT vaccine so far. See, usually, whenever there is an injury by means of any such things, maybe sometime the landslide injuries, or maybe stuck with iron materials, usually we will go for a TT vaccine. The reason is very simple, because tetanus spots are very commonly present in the soil, and they may be present anywhere. So therefore, for the prophylactic purpose, we have to go for the TT vaccine. Now, okay, that's okay, but in this case, the child has not taken any of the other vaccines also, including DPT. So when you give the DPT, so 1.5, 2.5, and 3.5 month, so you are giving three important primary doses of TT also. Then again, 1.5 you will have a booster dose, and 5 years again you have a booster dose. But the case is something different in this case. The reason is he has not taken any of the vaccines. That means primary immunization against the tetanus has been not done so far, not taken place so far. So quite challenging case. How you will deal this case? Now, if you go for the analysis of this case, now primarily we will have two tasks to do here. Okay, so one is, now at present we have to protect the child from this particular injury and its consequences, and we have to also protect this child for the future also, because child is totally unimmunized. Now, protecting now is very important. Presently, the child had got a injury which requires TT. So protection at the immediate moment is very important, as he didn't have any previous vaccination. So immediately what you have to do? Immediately you have to do is go for the thorough wound cleaning, and this will be followed by immunoglobulins of TT. Okay, so you have to go for immunoglobulins of TT immediately. Then to protect him for the futures, so you have to go for TT vaccines. Okay, you have to go for the TT vaccine. TT vaccine means TT vaccines are available individually, tetanus toxoid vaccines, or it is available with the DPT, or it is also available as DTaP. Okay, that we will discuss. So now, to protect the child for the future, you have to go for TT vaccines. Probably DPT vaccine you have to give in a gap of 1 month. 3 primary doses of TT vaccine has to be given in the gap of 1 month. Then after the age of 1 year, probably 15 months, 14, 15 months, you have to go for one booster dose. And after the primary dose, after 5 years, after the first primary dose, again you have to go for another booster dose. So this you have to follow. This you have to follow in this case also. Okay. So now, as none of the other vaccines are given, so DPT is over now. So what we have to do? Immediately you have to go for a TT immunoglobulin, and this will be followed by the total series of DPT vaccines 3 primary doses and 2 booster doses has to be given with the time schedule. Now, another important thing in this part is he has not taken any other vaccines also. Okay, he is not taken BCG, he has not taken hepatitis, not taken oral polio vaccine, and none of the other vaccine has been given, measles, etc. So, what we have to do in such conditions? In this case, none of the other vaccines are also given. So, we have to give all the other vaccines. So, how to give it? This is a big question. Now, we should know that what is the minimum and maximum age for the administration of the vaccine. Suppose if I say measles, up to what maximum age I can give it, okay, or OPV, what maximum age I can give it. So this has to be understood. Suppose, as in this case, this is a 10-year-old boy, not taken any of the vaccines. We have anyway we have corrected the DPT part, okay, TT part. Okay, now what about the rest of the vaccines? In a 10-year-old, totally unimmunized. So first you have to start thinking from BCG. Whether I should give BCG in this case is already 10 years. Okay. Now actually BCG is not needed. Actually BCG is not needed at the age of the 10 years because there is every chance that natural infection of a tubercular bacteria would have been taken place by this time, and therefore there is no need to give the BCG. Suppose if you want to give the BCG again, in this case you have to go for the Montauk's test. If the Montauk's test is positive, then it suggests that there is no need to give the BCG. Suppose very rare the Montauk's test becomes negative, okay, so then there may be requirement of the BCG depending about the condition of the child, maybe for example an immunocompromised child, etc. Otherwise, normally the upper age limit for giving BCG according to national immunization schedule is 1 year. Okay, after 1 year, if the child is coming to you for BCG, up to till 1 year he has not taken, then what national immunization schedule says is after 1 year there is no need. Definitely some natural infection, subclinical infection would have been taken place. But what IAP says is, Indian Academy of Pediatrics, it says is the maximum age limit is 5 years. Maximum age limit is 5 years because it is quite normal that national immunization schedule is always take the whole country. It considers the whole country, the situations and as well as other challenges of the whole country. So suppose if they say that national immunization schedule, if they say that if the child is not vaccinated up to 5 years, you have to go for BCG, then this has to be applied for the whole country. So they have to brought into the system. Okay, so they consider as a country as a whole, whereas IAP consider as a person as a whole, individual as a whole. So IAP says that 5 years, by 5 years, if till 5 years BCG is not given, again you have to repeat the dose. So only condition is you have to go for one Montauk's test, and if the Montauk's test is positive, no need to go for it. So that's over about BCG. Talking about rotavirus. So rotavirus is one more very important thing. Usually we will give it the DPT only. DPT1, DPT2, DPT3 will be also followed by the rotavirus. Now, as for IAP, the first dose of the rotavirus should be given at 15 weeks. Whereas according to national immunization schedule, the first dose of the rotavirus should be given at 1 year. Okay, so this is one, if it is missed. Then PCV, talking about PCV, if you don't have any comorbidity, then PCV should be given at 5 years. If the risk factors are there, then PCV should be given even after 5 years also. Risk factors is there. Okay. Now talking about the OPV. About the OPV, everybody knows we go for zero polio dose, and then so many multiple doses will go for it. But they say that up to 5 years you have to go for OPV. Even in the pulse polio vaccination program also, we are telling the same thing. 5 years, up to 5 years, you have to, if you have not given OPV, then you have to go for OPV oral dose. Now, but in this particular case, definitely the child requires the TT containing vaccines like DPT and booster and all those things. So that has to be given. But one more thing is he has to also take MMR. Is it? He has to also take the MMR. Now for TT doses, either he can go for DPT, but actually there is no requirement of pertussis part after 5 years and all, because incidence will come down. Therefore you can replace it with Tdap. Tdap where there is the pertussis portion will not be there. Okay, so 3 doses of Tdap given, or you can, if you want, you can go for DPT also, DPT vaccines also. Otherwise, Tdap can be given. But talking about MMR, nowadays it is replaced by MR. Okay, MMR or measles or MMR, now it is replaced by MR. So vaccine should be given at the first visit and thereafter 1 month later. That means, suppose a 10-year-old child, he is coming today. Today you give the first dose, then 1 month after again call back, you have to give the second dose of MR. Talking about hepatitis, that is also not given in this case. So hepatitis is also required the hepatitis B doses. So you follow, if you are giving from the beginning itself, we follow different schedules. So 013, 012, 016, like that. So anyway, so any of the schedule has to be followed for even for the hepatitis B also. So this is one problem that usually we will face in the OPD sometime, and this is a small guideline that how in such cases we have to adjust. Okay. Of course, different opinions are there, especially IAP and national immunization schedules. They vary in their opinions. But what I have explained is a general opinion regarding the vaccines when it is missed or not given, or child is totally unimmunized. Okay. So we will be back with another important case in the next class. Thank you very much.